Welcome back to NPO Showcase. My guest on this second segment is Jennifer Feuerstein. Jennifer is the Community Outreach Representative for Care Resources. That is the PACE program. Welcome, Jennifer.
Thank you.
Well, Jennifer, what is Care Resources and PACE?
Care Resources is a nonprofit organization, and we run a program called PACE. And PACE stands for Program of All-Inclusive Care for the Elderly. It's a national health care program to keep seniors living at home, out of nursing homes for as long as possible. And it's basically an all-inclusive, comprehensive health care program that's run nationally. And we at Care Resources implement this model of health care in Kent County.
And how long has it been around?
We opened in October of 2006, and we had 5 community partners who came together to fund us to get us up and running. And those community partners are Metro Health, Pine Rest, Grand Rapids Dominicans, HHS Health Options, and Holland Home. And so they saw the need for a PACE program in Kent County, and so they came together and got us funded and got us up and running. So we've been going full swing since October 2006.
Jennifer, what services does Care Resource provide?
We are a long-term healthcare, all-inclusive provider for seniors to keep them living at home, and so we provide everything a person needs. We provide all of their primary care, their specialty care, we provide their prescriptions, therapy, in-home care, we provide medical transportation, we provide end-of-life care. Basically, everything and anything a person needs to keep them living at home, we provide it. We also, the model is set up where it's an interdisciplinary team, and we coordinate and manage the healthcare plan for each of our participants. And so the interdisciplinary team is kind of the crux of this program, where it's led by our medical director, and it's our nurse practitioner, the social workers, the therapists, the pharmacists, home care coordinators, but it's this whole team approach where they're working with participants. It's a participant-centered approach, and they work with participants to create a care plan, oversee it, implement it, coordinate it, make changes, and it's a fantastic program, especially for caregivers. It's important for the senior to stay at home, but it's also important for caregivers because a lot of the burden is taken off of them because we're the ones that provide all of the services and manage all of the services. So for caregivers, they don't have to drive to doctor's appointments. They don't have to pick up prescriptions. They don't have to get their loved one to therapy. It's all done for them.
That's amazing. I suspect that a lot of people, as they hear about this, will wonder why they hadn't heard about it before and want to get in touch with you, because it seems to provide exactly what so many families, as they care for their elderly loved ones, need.
Yeah, it's a fairly new program, and that's why a lot of people aren't involved in it yet, because they just don't know about it. 3 years old is still very young, and so it's just getting word out there that this option is available for seniors.
How does somebody go about joining?
There are eligibility requirements for a person to become involved. They have to be 55 and older, they have to be a Kent County resident, they have to be able to live safely at home, and they have to meet the nursing facility level of care. The piece of it that they have to live safely at home, that home setting might be that they live in an apartment, in their own home. They might live in adult foster care, in assisted living, independent living, and that might be their home setting. As far as the nursing facility level of care, what that means is that they have some level of physical or mental impairment. They might need help with their activities of daily living. They might need help with bathing, dressing, feeding, transferring in and out of a chair. They might have dementia, they might have Alzheimer's, they might use oxygen, they might need skilled rehabilitation. So there's some level of physical or mental impairment, and basically that says that they could go into a nursing home. They're eligible for a nursing home, but it's our goal to keep them out of that nursing home for as long as possible. And so the process to get enrolled is you don't need to have a doctor's referral. You simply call up and talk to our intake coordinator, and she'll do the initial phone screening. She'll look at that initial eligibility to make sure that a person's qualified. We then have an intake team that goes out to the person's home to look at the financial piece of it. They look at, is the home safe for the person, and what's that level of care that the person has. And then from that point, then they come into Care Resources, and they will meet with the interdisciplinary team, and each discipline puts their piece of the puzzle together as far as what the care plan is for this person. And then it's about a 45 to 60 day process, and they start receiving services on the first of the next month, and then they're covered from the time they enroll to end of life.
What are the financial implications for a family?
A person has to have either Medicare or Medicaid. If a person is Medicare only, then there's an out-of-pocket cost that they pay each month. If a person is on Medicaid, then they don't pay for any of the services. They don't pay prescription copays, they don't pay office visit copays, everything is provided for them. The income limitations are a little bit different with a long-term program like PACE rather than traditional Medicaid. With traditional Medicaid, a person's income cannot exceed about $694 per month. With a long-term care program like ours, the income limitations are $2,022 a month, so it's significantly different. And so oftentimes people think that they're not eligible for Medicaid, but they may be for a long-term program like PACE. And so our social worker will sit down and work with the family to get that person eligible for Medicaid. If they don't currently have Medicaid, they'll work with them and assist them with that application process. And then people can be dual eligible, where that means they have both Medicare and Medicaid to provide the services for them.
So there's a piece of this that's federally funded then, is that correct?
Correct, yeah. We're funded, we have a three-way agreement with Centers for Medicare and Medicaid Services and the Michigan Department of Community Health. And how the funding works is we get a capitated amount, which means we get a set amount per month per person. And the money comes from CMS and MDCH, and it goes into a pool of funds, and then we manage the money. We are the ones that pay out for all of the services that a person needs. And that allows us to have a lot of flexibility with the services that a person needs. We can provide services like vision, dental, vision, podiatry, audiology services. For a person who's on traditional Medicaid, those services were all cut in July. For our participants, they can still see the dentist. They can still get podiatric care if they need to, because we're the ones that are paying out those services. And then with therapy, with traditional Medicare, a person is capped at so many visits. They're approved for so many visits, and no matter where their health is at that point, they're done. We don't have any benefit limitations, so a person can have therapy indefinitely if that's what keeps them stable and living at home.
I take it that at the national level, there must have been someone with a great deal of insight in recognizing that it was going to be much less expensive overall to keep a person in their own home than to have them in nursing facilities. That must have been very wise legislation. Do you know when it was passed?
The PACE program started back in the 1970s. It started in San Francisco, and it was in response because in the Asian community, they don't put seniors in nursing homes. And so they really needed a way to care for their loved ones without putting them in nursing homes. And so they started the whole concept of adult daycare. Eventually, it grew to become a medical model, and then it got permanent provider status with Medicare and Medicaid. There are 71 different PACE organizations around the country, and it continues to grow every year. There are more and more PACE organizations that open up because it's a very cost-effective way to use Medicare and Medicaid dollars. We take on all the financial liability of a person when they come into the program, and so there's there's a lot of benefit for using the Medicaid dollars this way. A lot of benefit for caregivers and for the participants themselves.
Talk a little bit about where it's located in Grand Rapids and what how are some of these services delivered?
We are located in Grand Rapids, but we service all of Kent County.
Okay.
We're on the southeast side, Fulton and Fuller area. And at Care Resources, we have a health clinic and we have a day center. At our health clinic, that's basically the person's doctor's office. That's where they see their doctor. That's where they get their prescriptions. They get their therapy. And then we have the recreational day center. And the recreational day center, the social piece of it is just as important as the medical piece of it. Seniors who decide to stay living at home, the downside to that is that they are very isolated and they don't have the mobility and they don't have the activities to keep them from settling into depression. And so we recommend that our participants come in at least once a week. Some people come in 5 days a week depending on their care plan. And when they're there, they don't necessarily see the doctor every time they're there, but they come in and they have lunch, and we have exercise classes, and we have educational programs. We have different forms of entertainment. And so there's that social component that's very important for seniors.
Now, is that day care, day center located like at Fulton Manor?
We're located in Fulton Manor.
Okay.
Yep. And
that's one of the participating organizations.
It is. Yep. One of our partners, and it's a unique dynamic because we're located in a nursing home, and it's our goal to keep people out of nursing homes, and there's always a a time and a place when a nursing home may be necessary. And for our participants, it's our goal to keep them out of a nursing home. But if they get to that point where their health declines, we will still care for them in that nursing home, and it's at Fulton Manor. So they're not disenrolled just because they go into a nursing home. We still provide all of the care for them.
How does somebody go about enrolling?
That's where they call our intake coordinator. You don't have to have a doctor's referral, and talks to our intake coordinator and basically starts the process right there of finding out if they're eligible, and then meets with the intake team and then meets with the interdisciplinary team. We have them tour, make sure it's a right fit. They can talk to the doctor, meet the doctor, and then services start for them.
I suspect that sometime the person that contacts you might be a family member that lives out of town that isn't nearby when mom and dad need this kind of assistance, and they hear about it. So that's an important piece also.
Yeah.
Jennifer, what are some of the challenges that exist in joining? Because it sounds like it's a very up thing, but I'm sure that there's some downs to it.
Right. People often say, this sounds too good to be true, and it is a fantastic program. The challenge for people is that they do have to give up their primary care physician. And this can be a difficult thing for people. Some people don't care. Other people, they've had their same doctor for 20, 30 years, and to hand that trust over to somebody else can be difficult, and we respect that, and we understand that. They also lock into our network of providers. We have currently about 175 different contracted providers that we work with, and that's everything from the durable medical equipment to supplies, in-home care, any of the specialists that they may need to see. They lock into that network of providers, and then they also use our primary care physician. As long as they lock into our network of providers, we call it a lock-in feature, they don't pay for any of the costs to any of the services. If they go outside of that network, then they would be liable for the cost, unless it was an emergency situation. If it was an emergency situation and an ambulance needed to be called in, then the ambulance will take them to whatever is the closest hospital. Otherwise, Metro Health is who we contract with for all hospital services. But we try to educate people that this program is so unique because, yes, you have to give up your primary care physician, but if you go into a skilled nursing facility, that's the first thing that happens is you give up your primary care physician. The other piece of it is that because it's all coordinated under one umbrella with one team, it's a one-stop shopping medical model. And we really know the participant holistically, and we know everything about them. When a person is piecing it together themselves, they have maybe 10 different doctors and 15 different prescriptions, and nobody's on board and paying attention to what is the big picture of this person's health care. And because of the team approach that we have, we oftentimes can reduce the number of medications that they're on, and it's just a very important piece to coordinate the health care for a person. So we try to educate them that, you know, the right hand knows what the left hand is doing, and there's no fragmentation in their health care when it's delivered this way.
And the family can, I mean, if something is happening that they're concerned about, they can talk to you about it and try to reasonably settle the situation, I assume.
Yes. Once a person's enrolled, we have a reassessment with them after 90 days, just to make sure that everything is going well for them and they're happy with everything. And then we reassess every 6 months or as necessary. And we have the caregivers come in and the participant come in to talk about, you know, what changes may need to be made. They know they're not going to fall through the cracks.
Great. Jennifer, thank you so much for being here today and telling us about PACE. And thank you for watching NPO Showcase, a regular feature of GRTV. If your nonprofit wishes to be showcased, you can contact me, Barbara, 459-4788, extension 115. And in closing, I wish you a peace-filled week.